A couple of years ago, we established one of the first craniofacial programs to train orthodontists to become specialists in managing children with craniofacial anomalies.
Basically, if we think about the cleft lip and palate child, the main defect or the main problem is in the dental area. So dental medicine is really responsible for anything that goes below the brain and is above the neck. So craniofacial anomalies are right in our ballpark.
We typically are a group of at least 10, 12 different services that come together. Nutritionists and dietitians and speech pathologists, nurse practitioners, geneticists. So you can see it's a broad spectrum of services that come together.
Here at Case Western Reserve University, since we have orthodontics, but we also have endodontics, which is the root canal specialist. We have prosthodontics, who are the specialists in making the prosthetics of teeth. We have obviously oral maxillofacial surgery. We have pediatrics, pediatric dentistry. These different disciplines may not exist in other type of programs.
My role is to help do the pre-surgical movement of the clefts and stretch the lips so that the plastic surgeon and the orthodontists and all the specialties can have a better result.
We're involved in the rehabilitation starting at the very beginning with molding the bone, following it up with creating space to put in bone into the alveolar cleft, then following that up with alignment of teeth. Then we work with the oral and maxillofacial surgeons, are the people that can then change the shape, because often the upper jaw bone, even if the teeth are straight, didn't grow properly. So we have to make adjustments in the size of this bone or the shape of this bone after kids are done growing.
Our particular influence in the team, if you will, we actually get involved more heavily at the ages of 6 to 7. At that point, they're being referred for what's called alveolar cleft grafting. The next time point for us then would be when their growth is complete. So typically for girls it's 15, 16, for guys it might be 18, 19. And at that point, we're now talking about jaw surgery.
I mean, some of these patients by the age of 10 have 39 surgeries. So I look up to our patients. They're so strong. You know, they come in here and even though they're shy, or some of them will say, "Mom, did I do a good job?" And I'm thinking, gosh, yeah, like they're heroes in my eyes.
So some of the patients that we see, I think the greatest impact that they have on me is really just emotionally. You see that sometimes the greatest highlight of their day can be coming to see us, because we're an understanding group of people that really reach out to try to make their lives better. And when you feel like you really had a chance to touch somebody or to impact them in a positive way, especially somebody that's been through so much their entire life, it really makes you feel very good.
I think the idea of how you deal with patients is very simple. If you treat children or you treat your patients the way you would treat your own children, I don't think you can ever go wrong.
I feel honored that I can even hold a spot in their lives, and I'm just happy that I can be able to give them a smile when they walk in the office and also make sure they have a smile when they leave.